Just to follow up on the last section of a free versus bound form of hormone, you have to understand and appreciate the need to understand this. As I said, if you produce more protein, so it tends to suck up all of the free form, and therefore you do not expect to see a feedback inhibition. On the other hand, also, I like you to clearly understand what happens during pregnancy and other states that tends to end up with rise in estrogen levels. As we stated, estrogen, testosterone binds to globulin. And therefore, what you expect to see is that the total plasma lipid soluble hormone will tend to increase in these cases, but the free plasma hormone remains constant at normal levels. So that's why actually those individuals do not show any sign of hyperfunction. So that's the last comment that I have with bound versus freeform. Let's now shift the gears and address mechanism of actions. When we address mechanism of actions, we like to be able to classify hormones based on their mechanism of action as well. So the first mechanism deals with amino acid based hormones and second messenger. As the name implies here, you're dealing with modulation of specific proteins on the cell membrane that tends to increase the production of a second messenger or decrease the production of a second messenger. There are serious proteins involved in this mechanism, amino acid based hormones and second messenger. G proteins uninvolved, GS proteins stimulating G proteins versus GI proteins, inhibitory proteins. And one more intracellular second messenger that can be cyclic AMP, cyclic GMP, calcium ions, IP3, diacylglycerol. All of those are considered second messenger. You're dealing with cell surface receptors in amino acid based hormones versus a steroid hormone mechanism, where the receptors are located on the nucleus. And therefore, you expect to see direct gene activation involved here. So I'd like you to keep that in mind. Gene activation by the hormone. Okay. When you look at this beautiful presentation here, that shows actually GI protein activations and adenylate cyclase activation that tends to release cyclic AMP. So let me just get my pointer here so you can see that clearly. Receptor binds with a specific hormone with a great specificity, of course, tends to modulate G proteins. So you have G protein bound to GDP that's replaced by GTP. So you tend to activate the G protein and tends to cause conformational change of adenylate cyclase. This enzyme will tend to cleave cyclic AMP from ATP. And then you're dealing with phosphorylation reactions that can take place at this level, or dephosphorylation reactions. So that's what you need to keep in mind in this slide. Examples for that. We already mentioned LH, which is produced from the anterior pituitary gland, can bind at specific receptor sites on the gonads, at the gonads, activate G proteins, activate adenylyl cyclase to release cyclic AMP. So you're producing protein kinase enzyme that tends to activate the cleavage enzyme, SS cleavage enzyme, that cleaves off pregabalin from cholesterol, and then you end up with testosterone. Of course, testosterone, as I said, circulates in plasma in a free form and in bound form to globulin. So that's the second messenger mechanism. You have everything explained to you well here, no problem with that. I did not miss anything. You have to keep in mind that the hormonal effect can activate GS proteins versus GI proteins. So you're dealing with enhancement of production of cyclic AMP or inhibition of production of CMP. Same presentation is addressed to you here on this slide, with exceptions that I tend to elaborate on the bridge actually to pharmacology here, some of the interesting concepts that you need to understand it, and that's the objective of this slide actually. So to make the long story short, again, you do have first messenger hormone, can be any of those hormones. Can be catecholamines that tends to get involved with bioamines, biogenic amines, thyroid releasing hormone, TRH, ADH, LH, RH, luteinizing hormone releasing hormone, or oxytocin. Tends to modulate G protein, we already mentioned that. You have modified G protein here activated by GTP. Tends to activate phospholipase enzyme. So that's a second, this is not cyclic AMP here, it's a phospholipase. Phospholipase will tend to act on phosphatidylinositol to give you diacylglycerol and activate protein kinase C here to enhance the side here. When you go on to this presentation, you have phosphatidylinositol will give you inositol first, PI that can be converted to PIP that can be converted to PIP2. Your second messenger here is IP3 here. So PIP3 can be cleaved off here to give you IP3. Inositol triphosphate can function as a second messenger. Inositol triphosphate can produce diphosphate, inositol diphosphate, can produce IP, or can produce inositol, which merge with phosphatidyl inositol to give you PI, and the circulation will take place here. This slide is taken from Mary Anatomy and Physiology textbook, but the reason that I adapted this is to elaborate on this section here. And I like to stretch this a little bit beyond this level and introduce you to bridge to pharmacology. As you all know that lithium is a bipolar agent. It's essentially used for bipolar problems. People with manic bipolar problems. The function of lithium is to interrupt this sequence. So you're actually interrupting the production of a second messenger here. So it tends to interfere at this level here. So I'd like you to keep that in consideration. So when we go back and address CNS, address those drugs, you can see essentially what we're talking about in terms of the valuable understanding of the receptors and the classes of receptors. I summarized to you here this in great detail here. We said that second messenger includes cyclic AMP. Second messenger include calcium ions. We said the G proteins involved with activation of phospholipids that tends to cleave PIP2 to two fragments, inositol triphosphate, that's IP3, and diethylglycerol that can act also as a second messenger to activate protein kinase C. Common question, you have to clearly understand the function of protein kinase A versus protein kinase C. Common question at USMLE exam. If you miss it, you cannot really differentiate between those two second messengers. Calcium is considered as a second messenger, as I mentioned to you, and that deals with activation and modification of cellular proteins. That's a function of lithium treatment of manic depressive illness. So the manic depressive illness that takes with bipolar problems deal with overactivity of certain CNS cells, abnormal high levels of hormones. This abnormal high level of hormone will tend to stimulate PI cycle. Lithium will tend to interrupt this cycle, and it's used effectively as anti-bipolar agent. So I mentioned to you here the exact function involves phosphatidyl inositol pathway. This phosphatase enzyme that tends to cleave off the phosphate group from IP to inositol is inhibited by lithium. That's the exact mode of action of lithium. In addition to that, they believe also that lithium somehow modulate and interfere G proteins as well. The intracellular receptors, as I said, the receptors are located on the nucleus, and those lipid-soluble hormones will tend to bind to those specific receptors, so it's going to pass this bilipid layer, get into the receptors, and activate at the genetic level the production of proteins, and that's why their half-life has to be long. If you inject again a patient with a lipid-soluble hormone, you do not expect to see the effect right away. It will take longer for the effect to take place. This is the nice presentation that I addressed it to you here. Adrenal cortex produces steroid hormones that tends to bind to specific receptor sites on the nucleus to produce at the genetic level proteins. So in summary, here that's a function of a lipid-soluble hormone that binds with the receptors on the nucleus, and that's a function of steroid hormones, glucocorticoids, estrogens, testosterone, progesterone, aldosterone, vitamin D, all are good examples for that. So to sum this up, you have here the differences in terms of mechanistically between lipid-soluble hormones and water-soluble hormones. Water-soluble hormones binds to cell surface receptors, modulate G proteins to produce second messenger in a form of diacylglycerol, IP3, calcium, cyclic AMP, or nuclear receptors for lipid-soluble hormones that tends to modulate the production of enzyme or protein synthesis. Lipid-soluble hormones have a long half-life. Water-soluble hormones have a short half-life. Lipid-soluble hormones circulate in bound and free form. Water-soluble hormones circulate in a free form, but they form vesicles. You have to keep in mind that those vesicles actually have the proof hormone and an enzyme. So when there is a need for the free hormone can be cleaved off. Interesting concepts. With that, we address the mechanism of actions. Last but not least, we like to be able to classify hormones based on their mechanism of action, based on their structure, and so on. So I already said, based on mechanism of action, you're dealing with intracellular hormones, intracellular receptors. Those are lipid-soluble hormones, androgens, vitamin D, estrogen, as I said, with exception, see androgen, adrenal androgen are covered by sulfate and therefore can circulate as a free hormone. Vitamin D, estrogens, glucocorticoids, mineral corticoids, all those classes are considered lipid-soluble hormones. Thyroid hormones, T4 is the bound form, T3 is the free form, retinoic acid. So all of those belong to intracellular receptors. Those ones that bind to the cell surface receptor, angiotensin 2, chronic gonadotropin, calcitonin, antidiuretic hormone, ADH, PTH, parathyroid hormone, follicle stimulating hormone, somatostatin, catecholamine, glucagon. So you can see actually the nature of those all are polypeptides, short polypeptides. They can modulate production of second messenger. The second messenger does not have to be tied only to cyclic AMP. GMP can get involved as well. atrial neurotrophic factor ANF can be considered as a modulator for the second messenger GMP. Let's follow this pattern. Second messenger also can be calcium or PI, as we stated, phosphatidylinositol, or can be both. And we already addressed function of the bipolar agent lithium on the second messenger. Gastrin, gonadotropin releasing hormone, thyrotropin releasing hormone, ADH, all of that can also follow calcium or PI or both. Kinases, tyrosine kinase with respect to insulin, growth hormones, or phosphatase activities can be second messenger. The classification can be based on chemical composition, and that's very simple. As I stated, some of the hormones can be modified form of specific amino acids like tyrosine, thyroxine, T3 and T4, coming from tyrosine amino acid, tetraiodotyrosine or triiodotyrosine. It can be selected peptides, oligopeptides made up of several amino acids. ADH follows this pattern. TRH, thyroid releasing hormone, follows this pattern. Gonadotropin releasing hormone follows this pattern. Somatostatin follows this pattern. CCK, secretin, intestinal peptide follows this pattern. Gastric inhibitory peptide follows this pattern. Polypeptides, you can see all list here of hormones that function as a polypeptides. PTH, calcitonin, insulin, glucagon, pancreatic polypeptide, gastrin, insulin-like growth factors, epidermal growth, nerve growth factors, ACTH, all of those are considered. Or protein hormones, growth hormone, GH, it's a protein. Prolactin, it's a protein. Platelet-derived growth factor, it's a protein. Thyroid stimulating hormone, and erythrobiotin. Can be small molecules, we already mentioned. You have a table here that addresses very nicely. So catecholamine, epinephrine, norepinephrine, dopamine. Where are they coming from? Coming from tyrosine. Cortisol, aldosterone, testosterone, estradiol, cholecalciferol, and the other forms of vitamin D, all coming from cholesterol. Thyroid hormone, T4, T3, coming from tyrosine. Serotonin, melatonin, prostaglandins, coming from tryptophan. Okay, arachidonic acid, prostaglandins, arachidonic acid deal with cyclic GMP. Anatomically, you have to keep this figure in mind. So you have hypothalamus, anterior pituitary gland, that tends to produce LH, TSH, GH, ACTH, thyroid, calcitonin, T3, T4, PTH, lungs, thiamine, thymobiotin, heart, ANP, secretin, stomach, glucagon, insulin, pancreas, mineral corticoids, androgens, adrenal cortex, ovary, estrogen, progesterone, relaxin, tests, testosterone, androtestosterone. This is a very decent summary here for those classes. Lipid-soluble hormones versus water-soluble hormones. Solubility lipophilic. Keep in mind lipophilic. They are lipid soluble in nature, and therefore they have to be carried by specific carriers. What are those carriers again? Cortisol binding globulins. Globulins is essential carrier for cortisol, essential carrier for thyroid hormone, essential carrier for estrogen, testosterone. That's why you expect to see a free versus bound form. Polypeptides, water-soluble hormone, hydrophilic. So they exist in a free form. They can form vesicles. Those vesicles actually store the pro-hormone and an enzyme, and when there is when you need it, so you clip it off right away in a matter of milliseconds. But the thyroid hormones, the lipid-soluble hormones, due to the fact that they are carried by specific carriers, so they have a long half-life, and they also are synthesized when there is a need for them. Transport proteins, I already addressed it to you. Yes, here, globulin, serum albumin, common carriers. Water soluble, there is no free form. Half-life, of course, long half-life. Common question in USMLE exam. For steroid, thyroid, vitamin D, lipid-soluble hormones, short half-life. For water-soluble hormones, receptors, intracellular receptors. You form a complex with those intracellular receptors, with lipid-soluble hormones. Modulation was with water-soluble hormones. So you tend to produce cyclic AMP, cyclic GMP, calcium phosphatidylinositol kinase, cascade tyrosine kinase, that tends to modulate those. Concentration. You expect to see them constant here. Why is that? Because you have an equilibrium between the bound versus the free form. With polypeptide proteins, with water-soluble hormone, they're very low and can be changed very rapidly. That is the end of my presentation for today. So in keywords, to sum up what I mentioned to you, and I see actually that majority of students still here, we just missed 2 of them. In keywords, I would like you to understand endocrine system. There is really very little room for memorization. Understanding play an essential role first. To understand the endocrine system, you have to appreciate the terminology. You have to appreciate the mechanism of action. You have to appreciate the significance of feedback regulation. You have to appreciate the fact that hormones do exist in a free form and bound form. You have to clearly understand differences between lipid-soluble hormone and water-soluble hormone. As I said, the endocrine system constitutes a major section at USMLE exam. You have to appreciate the normal physiology first in order to understand the pathophysiological aspects. When we address those classes, we're going to address it in this sequence. In some cases, we're going to address it together. Normal physiology along with abnormal physiology. You have to clearly define primary disorder versus secondary disorder. And you have to be able to tie that with regulation. I highly appreciate having all of you here. I see some questions and I'm willing to address all of them. We still have time. This lecture will be available as a recorded version The answer for that is yes, but I do like to see more of learners attending those classes. Otherwise, I will limit those to private YouTube or with a link. Okay, because actually it's your enthusiasm that drive me, my enthusiasm. I intend in future to avail all of how to be your own doctor, achieve and sustain a healthy lifestyle as a public YouTube. With this section, I will intend to have as much as I can out of it. But later on, I like actually to have a complete set of clinical cases, discussion, and clear presentation for all of those three topics: pharmacology, physiology, and I like to start out with the endocrine system first, and then biochemistry. And those will be available to your use at a minimal fee that covers actually having to adopt the webinar along with the video processing along with the stuff. I like to have your feedback on that. I like to have your feedback on the clarity of the presentation. I like to help you, so please provide me with your feedback and tell me exactly how can I assist you to achieve your goal. I'm here mainly to help you out. I have 3 of my young men and daughter are physicians. 2 of them are physicians and 1 is a student, completed her 2nd year in medical school, and I love to help you and help all my former students that I taught at numerous medical schools and pharmacy schools and other professional schools. So please tell me, how can I help you to achieve your goal? Thank you. Let me address the second question here. I do not. Okay, with that said, any other questions, any other comments? So please provide me with your feedback, and I see you actually next Tuesday. Next Tuesday will be a pharmacology lecture. So please sign up for it, because I had actually the limitation here is, and I'm willing actually to expand that to 500, but the limitation so far is to 100. So essentially there are about 85 students signed for this presentation. So I'd like to see you all next week. Thank you and have a great afternoon until I see you next week. And please provide me with your comments, as I said. Let me see, I want to address this again. Yeah. Okay, any other question? Let me see. Okay, thank you very much. Okay, very well. Okay, thank you. Highly appreciate having all of you, and I look forward. Yes, loud and clear. Yeah, please provide me with your comments. Thank you for the presentation today. Wonderful. Thank you all. Thank you. Thank you. Thank you. Thank you. And I love you guys. I love you, and I like to help you as much as I can. I'm here for you. Feel free to contact me at any time. Thank you all and have a great afternoon. Bye-bye now.